movement is essentially border crossing behavior. And we want to look at it as a key element for understanding within group differences or the heterogeneity that exists among Latino border residents. Perhaps to state the obvious, Latinos are not a homogeneous group. Even within our local Latino community, you will find that we range in age, gender, income, the types of jobs that we do, as well as how we communicate versus how much Spanish we speak versus English. In essence, there are many differences that exist within any population that must be considered in health research, because different demographic characteristics can lead to differential health risk profiles and outcomes. For example, we know that gender is an important factor for studying mental health. Latinas are consistently found to have higher rates of depression when compared to Latino men. Likewise, nativity or origin of birth is important to consider, as research shows that Mexican immigrants in general have better mental health than their U.S. born counterparts. To date, the majority of trans-border health research has focused on people who cross the border to purchase pharmaceuticals and or seek health services. While this research is important, we believe that trans-border mobility remains a largely unexplored key factor for contextualizing the heterogeneity that exists among Latino border populations. Thus, the purpose of the current research was to create a descriptive profile of trans-border mobility among a sample of U.S. Latino border residents, and to examine the relationship between border crossing behaviors and mental health by identifying both risk and protective factors for depressive symptomology. And I'm going to use the term depressive symptomology and depressive symptoms interchangeably. For this research, we used data from the 2009 Ecological Household Survey, which employed a two-stage stratified random sampling design. The study sample included 1,002 residents who were 18 years or older, identified as Latino, and who were willing to complete the survey. Specific to the analysis that I'll be talking about today, our total sample size was 114 people. We had a loss of 188 people due to missing and some ambiguous data regarding traveling back and forth to Juarez. So due to time constraints, I can't go into great detail about the measures now, but I'd be happy to answer questions at the end. To briefly orient everyone, our main predictor variables were transborder mobility and stress. For transborder mobility, which we conceptualize as commuting back and forth between Juarez, people were categorized as either never traveling to Juarez, people who previously traveled, and those who continuously commute either monthly or weekly. Stress was operationalized as being worried or stressed. Low stress meant you were either worried or stressed. High stress meant you reported being both having excess worry and stress. And then if you said no to either of those, then you were not stressed. For our covariates, we had all the usual suspects: gender, income, education, acculturation, familismo or family cohesion, and social support. Finally, our dependent variable, depressive symptomology, or reports of depressive symptoms that was measured continuously, was assessed using a modified version of the mental health inventory that is part of the SF-36 health survey. For analysis, I ran frequency statistics to analyze the distribution of the demographic variables for the four mobility groups. Next, I conducted bivariate analysis to determine whether there are significant differences between the groups. And then we used linear regression to test the direct and indirect effect of trans-border mobility on depressive symptomology. Again, due to time constraints, I cannot elaborate on all our findings, so I'm just going to really report the major trends. Between the 4 mobility groups, we found statistically significant differences for gender, education, income, health insurance status, acculturation, and familismo. Specifically, the greatest proportion of women were found in the weakly mobile group. The never and previously mobile group were the most educated, earned the most money, and were more likely to have health insurance. In contrast, the monthly and weekly mobile respondents had higher levels of stress, lower levels of acculturation, but the highest levels of familismo or family cohesion. With regard to our regression models, we were unable to detect a significant main effect for trans-border mobility. For our stress variable, however, we found significant and positive association whereas the levels of stress increased, so did depressive symptomology, which makes sense. If you're stressed out, you're going to be you're more likely to have a mental health problem. Most interesting, though, is that when we tested for the indirect effect of border mobility, we did find a significant moderating or buffering effect. Specifically, for respondents who reported low levels but not high levels of stress, increased border mobility was associated with lower depressive symptomology. Okay, let me repeat that again. For respondents who reported low levels but not high levels of stress, increased border mobility was associated with depressive symptomology. That may still be confusing for some of you. So I plotted an interaction to help us kind of make sense of what that means. So if we look at this first column here, oops, oh no. Okay, here we go. Oh, there we go, thank you. Okay, in the no stress column, we see that, okay, so here are the 3 groups. And of course the referent is the never mobile. Previously mobile is in green, monthly mobile, weekly mobile. So we'll take the blue line. These are the people that most frequently travel to Juarez. So for the people that reported no stress, so they said, I'm not stressed out, I don't have excess worry, they have the highest levels of depressive symptoms. However, when we take into account both those who report low stress and then we look at mobility, then we see that there's a crossover here and then the trend reverses. So then we see the people that travel the most, so the weekly mobile, they have the lowest levels of depressive symptomology, followed by the monthly mobile and then the previously mobile. But you may be wondering, what does all that mean? Why should we care? Well, as I hope to have shared in this presentation, transborder movement allows us to further contextualize the heterogeneity that exists among Latino border populations, including the particular vulnerability that mobile residents have, and those that travel the most tend to have the least amount of education, earn less, and lack health insurance. Also, when conducting mental health research, I think looking at transborder mobility reminds us that we must look at both risk and protective factors. Because in this study, we found that both familismo and transborder mobility to be protective. Consequently, transborder mobility offers new insight towards understanding within group differences and and mental health among Mexican origin adults. In closing, I'd just like to thank the HHDRC who made this work possible, as also acknowledge my co-authors and mentors, Dr. Balthazar, Dr. Morea, and Dr. Hayner. Thank you.
Are there any questions? Guess we're waiting for lunch.
Have you looked at, I'm sorry. Have you looked at William Vega's work? Okay. Yes, they did a big, huge study on mental health among immigrants.
Yes, I think what you're referring to is the MAP study, where they had over 3,000 people, and it was looking at Mexican origin adults. They actually didn't, I used that data set for my my dissertation. It's over 10 years old now, but one of the things that they didn't account for, even though it's such a great all-encompassing study, was the fact that people did cross the border.
You mean the border mobility?
Right.
Right.
Yeah, that was not one of the factors they looked at. I think, was there another question over here? Okay, over here.
Do you have any hypotheses of why you have these lower stress with people that cross more often? Could it be that they have maybe less stress to work, or is it more that they're closer to the family? Do you have any hypotheses that explain this line?
Right. Well, it is counterintuitive, right? Because especially with all the violence going on in Juarez, why would, you know, leaving the safety of El Paso and going to Juarez, why would that be protective of health? Why, you know, because there you're more likely to be exposed to just the turmoil and violence. So we have been thinking a lot about, well, what does this mean? And I think part of the answer is, and something that we're bringing up in our manuscript, is that we don't think it's the travel per se that's being protective. So crossing the border is not necessarily, it's not going to magically help your mental health. What we think may be happening is that we did look at social support, but we think that maybe something else is going on. So that when they cross the border, a lot of people here have family members. And just because you're safe doesn't mean that you're worried about the family member's ends. So when you cross the border, you may in fact be having this short mental health respite where you realize, okay, I can check on my family members, they're doing okay. And then you come back over. Because it's not, whatever this protective element is, it's not strong enough to combat the people that have high stress. So it's something maybe that's more temporary. So things like desensitization against violence, I think that's probably not going on. But it's kind of open. We're open to ideas and interpretations. Unfortunately, the focus of the data set and the study was not to look at violence exposure and coping, but we are looking to expand that. Yes?
I'm sorry I missed the beginning of your presentation, but couldn't it be that people who are less stressed are just more likely to travel as opposed to traveling having anything to do with their stress? Did you have a way of knowing the causal direction?
No, because it's cross-sectional, so we can't really determine causality. But we did see that. I think that to say that they would be less stressed, we know that the people that travel more did report higher levels of stress, and they were also the most socioeconomically disadvantaged. Yes.
One more question.
I think
Yeah,
she was.
given your interpretations and just following up, the questions still, where do you move from here, given your current interesting findings?
Well,
Like, for instance, the finding there about the low
definitely. We've actually applied for a grant so that we can kind of start to really, you know, we're using border mobility to contextualize heterogeneity, but now I think we've kind of opened Pandora's box and we're saying, well, okay, what's really going on when people cross the border? So we'd be really interested in going back and talking to these people and seeing what exactly are they doing when they cross the border? Are they seeking mental health services? And so our next paper that we're going to begin to look at is looking at healthcare utilization in Mexico. Okay, I think that's my time. So.
And after Alma's talk, all 6 speakers will be at the front, and we can ask questions of all 6 speakers when they're all there, all right? So we have one more presentation.